Yeah, so we had a very good, interesting sort of red cell session this time. We discussed two topics in PNH, paroxysmal nocturnal hemoglobinuria, and the rest were in hemoglobinopathies. In PNH, there was a very interesting topic that we discussed was the comparison of an eculizumab biosimilar, and it was very good to see how the biosimilar product was being developed as an alternative, as a sort of cheaper alternative, which would be accessible to not just patients in the developed world, but also accessible to patients in the developing countries. The other PNH study was to look at conversion of patients who need high doses of eculizumab to ravulizumab, and that was also successfully converted. So it was interesting discussions came out of that. The rest of the talks were mainly with hemoglobinopathies. So we heard about a new product which was a sort of next generation voxelotor product called 601, which is also an allosteric modifier of the hemoglobin molecule, which has a higher affinity to hemoglobin compared to the old voxelotor molecule. And there was some mouse work being done to look at sort of end organ effects of this, or improvement of sickle cell end organ damage compared to when this product was used. So it's interesting to see the mouse work, so I'm hoping that it will translate to sort of phase 1 studies in the future. There was also another study, a much more sort of closer to home and more real life kind of studies. One was to do with the use of the use of voxelotor in a named patient program, and how the UK population was doing with that. It was interesting to see that not all doctors were measuring the important parameters that needed to be measured. So it's been an interesting lesson to kind of take home from that. And also looking at the other very interesting abstract that was presented was actually to see what the sort of thalassemia landscape in the UK. So it was really helpful to see that there was quite significant mortality and poor quality of life across all ages and over time, even in the last few years compared to in the past. So it was quite a sort of humbling bit of information that was gathered through hospital episode data, HES data. Yeah, so that was all the kind of abstracts that were discussed in the red cell session this time.